torture or not? Torture is the action or practice of inflicting severe pain or suffering on someone as a punishment or in order to force them to do or say something. Would it be cheaper or expensive to bring the guillotine back and leave the lethal injection behind? Us U.S. citizens have to pay taxes, and those taxes go into prison, government help for people, hospitals, police, firefighters, and so on. But why should we pay for the people that are being sentenced to lethal injection, such as treason, espionage, murder, large-scale drug trafficking, or attempted murder of a witness, juror, or court officer in certain cases? Why was the lethal injection invented? Lethal injection was first proposed on January 17, 1888, by Julius Mount Blair, a New York doctor who praised it as being cheaper than hanging. Blair's idea was never used due to the series of botched executions and the eventual rise of public disapproval in the electrocutions. Lethal injection gained popularity in the late 20th century. The cost for a lethal injection dosage is $90. What does the lethal injection contain? The lethal injection contains 100 milligrams of pancuronium bromide, also known as Pavulon. It's a non-depolarizing muscle relaxant, a paralytic agent that blocks the action of acetylcholine at the motor end plate of the neuromuscular junction. The typical dose for pancuronium bromide in capital punishment by lethal injection is 0.2 milligrams, and the duration of paralysis is around 4 to 8 hours. On the lethal injection, there's also a dosage of 100 milliequivalent of potassium chloride. Potassium is an electrolyte, 98% of which is intracellular. The 2% remaining outside the cell has great implications for cells that generate action potentials. Doctors prescribe potassium for patients when potassium levels in the blood are insufficient, called hypokalemia. The potassium can be given orally, which is the safest route, or it can be given intravenously. The usual intravenous dose is 10 to 20 milliequivalent per hour, and it is given slowly since it takes time for the electrolyte to equilibrate into the cells. When used in state-sanctioned lethal injection, bolus potassium injection affects the electrical conduction of heart muscle. The lethal injection also contains a dosage of sodium thiopental, 2 to 5 grams. It's also known as sodium pentothal. It's an ultra-short acting barbiturate, often used for anesthesia induction and for medically induced coma. The typical anesthesia induction dose is 0.35 grams. Loss of consciousness is induced within 30 to 45 seconds at the typical dose, while at 5-gram dose, 14 times the normal dose, it's likely to induce unconsciousness in 10 seconds. A full medical dose of thiopental reaches the brain in about 30 seconds. This induces an unconscious state 5 to 20 minutes after injection. Approximately 15% of the drug is in the brain, with the rest in other parts of the body. If all of these drugs are added, why call it a humane way to die? What can go wrong, you may ask? Anesthesia may not work. If a needle is not inserted properly when the anesthesia is administered, the inmate will feel every drug going into his, her, them, they, their system. The person may also remain awake. All these drugs being combined but not properly anesthesia is used, the person will feel each drug. The person may feel suffocation. If they don't put enough anesthesia, the patient will feel like drowning, but won't show any physical reaction of pain due to the paralytic drugs. The vein may be hard to find. If they try multiple times to find a vein to put in the IV catheter, the catheter will be inserted into the groin vein, a jugular vein in the neck, or subclavian vein. If so many drugs are being added, why still clean the prisoner with an alcohol wipe? Or why not use the same needle on each person? Either way, they will still die. The inmates see the lethal injection as a peaceful, humane, and calm way to leave this place after the crime they are sentenced for. They don't respect the system because they know they have a peaceful way to leave without suffering. But why take the guillotine away and put a humane way to die? The last beheading was on the 10th of September 1977. The guillotine was stopped because people looked at it as inhumane, because they made people watch it and there was a lot of blood, so they thought it was disgusting. Also, it had been used in abundance during the French Revolution and has become the symbol of terror regime. Apart from the fact that from a humane point of view, the death penalty itself is unacceptable, the guillotine is a quick and painless way to have someone killed. Much better than electrocuting or poisoning someone to death by all means. The guillotine was built by a doctor of Lyon, Dr. Joseph Ignace Guillotin, on 1789. The guillotine consists of a wooden frame with an angled blade that runs along grooves. After the executioner raises the weighted blade with a rope, the condemned is placed on a platform with his or her head in a round wooden frame called a lunette. The executioner lets go of the rope, allowing the blade to drop, and in some moments they will put a basket for the head to be dropped in there. They may say that after being decapitated, your brain still works, but science shows that the brain needs oxygen. The brain and all structures it supplies need oxygen to function. The brain accounts for 20% of all oxygen used in the body. Some fun facts about the guillotine is that if they don't sharpen the blade before decapitating someone, they would have to drop the blade and it would just go halfway, and the person being decapitated will still feel everything and see everything and will have to wait for the blade to be dropped once again for its head to be chopped off. So my question is, should we bring the guillotine back or keep on wasting money on a lethal injection?